I'm excited to share with you the newest program at St. Helena Hospital. Senior Behavioral Health is a unit that adds a service that's desperately needed, not just in our community, but all over Northern California.
Today, there are only 14 beds in San Francisco to take care of geriatric patients that have psychiatric conditions.
There are not many such units in the entire country, and definitely not many in this area itself.
So we decided to look at the feasibility of opening a senior behavioral health unit where we could take care of seniors that had mild dementia, that were depressed, and provide them a healing place in a warm environment with the right staff, the right program, the right physicians.
This is a population that's really at risk. 20% of the elderly suffer from depression.
When a patient comes in, when we accept a patient, it could be for any number of reasons. People could be depressed, they could be anxious, they could have memory problems.
It's more common to have depression too if you're suffering from a chronic illness. And we know that 80% of the elderly have at least one chronic illness.
In order to be admitted to our program, it really does take a simple phone call. We have an intake department staffed by registered nurses that will do an assessment, triage that patient, have an admitting physician admit them, and within a few hours we're able to accept a patient onto our unit.
When they come to the unit, the first thing is they get an assessment, what we call as a psychiatric assessment, which somebody like me would do. Then my colleagues from the internal medicine department, they would come, whether it's a hospice or the nurse practitioner would do a physical exam as well, and we would do a battery of lab work and imaging studies if needed.
We take patients and we address not just their psychosocial needs, their psychiatric issues, but also the physical, the nutritional needs.
When I talk about medication, one of the concerns people have is, is my loved one going to be turned into sort of quote unquote a zombie? Are they going to be over medicated? The idea is not to sedate a patient, then there is no quality of life, but the idea is to have the medications do their desired effect without causing these kind of side effects.
This program is really to take care of our patients, our seniors, in a crisis situation in a short term. Typically, our length of stay is 2 weeks. And then they'll be back to either their skilled nursing facility or their home.
It's similar to, somebody having a broken bone and they don't stay in the hospital till the bone gets completely healed. But their fracture would be set and they get a plaster and then they would go home.
It's not just about taking care of patients in that crisis. We're also going to help the patient and their family members navigate the next steps. What do we do now?
Many families are nervous, of course, when it's time for their loved one to come home because they've had this good period of time where they're here with all these activities and groups and they're really thriving, and so families need a little bit of education towards the end and a little hand-holding just to know that everything's going to be okay when their loved one gets home.
This is all about the patient and the family.
The dedicated professionals that care for these patients are just wonderful, and it's a calling for them.
We look for people that really care and also have the clinical expertise that we're looking for.
What's different about my staff is that they really care. They're compassionate. They chose to work on this unit because of the population, and they feel a sort of connection with the older adult population.
The great thing about this program here is that we're in a community hospital.
So we have services available readily to us. We have ready access to all the lab work. The results are readily available. We don't have to wait for a couple of days. We don't have to send our patients outside to get their imaging studies done, whether it's an X-ray or a CT scan or an MRI.
To see the patients respond to their caregivers is just so meaningful.
We're here at St. Helena Hospital to provide that intervention and that help for those patients.
I will know we have been successful when I talk to a family member and can know that we were part of making a difference.
And that's the reason I drive here every day from like 100 miles away, because this keeps me going.
This will, I know, will make a difference.